Hey guys, it's Monica, and I'm going to be taking you through my web mapping and development final project showing you maps of COVID-19. So, just to give you some background, coronavirus, as we know, is a worldwide pandemic happening right now that originated in China, and there are two scenarios for how it began. The first is that there were spike proteins that mutated to bind to molecules that are similar in structure to a protein that humans have, and this enabled humans to infect other human cells. The second scenario is that it crossed from animals into humans a while ago before it was capable of causing disease, but then over the span of years to decades, there were evolutionary changes that allowed the virus to gain ability to spread through humans. The scale that I worked with for my final project was mainly the United States, but I also pulled in other countries that are mainly affected. Um, Such as Italy, Germany, France, Spain, and the UK. And the theme was that I wanted to look at the total of cumulative confirmed cases, deaths, and also active cases within the US. I then wanted to relate this case versus death ratio to other countries drastically affected, as well as other historical pandemics. So the data that I used mainly came from the United States Census Bureau. I also relied heavily on GitHub and Johns Hopkins University as sources for my raw data. And then I used QGIS to combine my raw data CSVs to the shapefile that I extracted from the Census Bureau of states in the US. As you can see, my narrative of data is listed here on the left, so I converted string fields such as deaths and cases to integers using toInt converter, and then once this was finished, I exported my product as a GeoJSON. My methods and my thinking were that I wanted to compare again the number of total cases versus death rates, but in order to do this, I wanted to dive deep and analyze different factors that may act for why there are different numbers, why some states have lower cases versus other states, why some countries have lower death counts than other countries, and again, some things that we may have implemented in the current pandemic happening, and compare that to other historical pandemics and what methods were in place during those times. So now I'm going to take you through my maps, and my three maps were produced using Leaflet and Mapbox, and then my two charts were produced using Google Charts. So the first map that I'm going to take you through is the cumulative total of cases. And this is also super interesting to look at in alignment with the cumulative deaths. So this is my cumulative cases, and it should be noted that all this data is from April 24th, 2020, and is obviously subject to change, but the overall consensus will pretty much remain constant to almost constant in that New York, as you can see with the darkest color, the gradient goes from low to dark with comparison to the number of cases that state has. So as of April 24th, New York had over 258,000 cases. And then as you click on different states throughout the US, a pop-up will appear with the state name and confirmed cases. And you can see that Wyoming actually had the lowest number of cases. So this is really interesting, and you can drag and you can zoom in and zoom out, and it shows you Alaska and Hawaii. Um, so super interesting. And then when you relate this to the deaths, again, you can see that New York carries the largest number of deaths, reaching over 19,000 as of April 24th, 2020. At this time, Wyoming only had two confirmed deaths, so they hold the lowest death rate. And you can also see that South Dakota, North Dakota, Montana, they also have low death rates. And I will be talking about my projected reasonings for why this is occurring later on in my presentation. But now to show you the active cases within the US. So this is calculated from the cases first death rate, and this is a proportional symbol map that shows the circle radius in relation to the number of active cases in that state. So you can click on different circles and they show you geographically where they are. You can zoom in, and here you can see that New York had 144,000. This is New York City, but you can also click on other areas within New York. And you can see the count in those areas as well, and you can drag it across the US and see where cases are lower or higher given the radius of the circle. And then moving on to my charts. So again, I wanted to compare the case rate versus death rate across Spain, Italy, France, Germany, and the UK. And one interesting immediate observation I made was that Germany doesn't have the lowest number of cases, but it has a lower number of deaths in relation to these other countries. So you can see at this time, which was April 26, 2020, Germany only had 5.88K deaths. The UK had a lower number of cases, but a higher number of deaths, sitting at 20.7K. So a pretty big jump there. And again, I'll be talking about why I think that is happening later on. But lastly, my chart showing coronavirus in relation to other pandemics. So here are two circle charts. This is the cases in relation to population. So I wanted to see in what way is this affecting the total worldwide population, because of course we know that the Spanish flu affected a large number of people, but the population was also significantly lower at that time. It sat at about 1.6 billion, I believe, when that happened, and now we're at 7.5. So there is a difference there. So you can see that the Spanish flu still takes the largest amount of this circle, sitting at 95.6. And then there's also swine flu at 3.1 and COVID at 1.3 in relation to population. And then this is a second circle map showing the fatality of coronavirus compared to that of other historical pandemics. So this is a percentage of death rates occurring from these pandemics. So you can see the ratio is actually, it lines up fairly closely when you're considering fatalities. So the Spanish flu had a fatality of 26.2. Chlamydia had a 10% fatality rate. And then SARS had a 10%, 26.2, and COVID right now has 8.22%, sitting at around 21.5% of the circle. So that I thought was super interesting to see this information laid out. And again, I use this forming Google Charts and extracted my data from Mainline Health. It was for that one. And then moving on to my results and discussion. So as noted before, the state with the lowest death rate was Wyoming, versus the state with the highest death rate was New York. And I think why this is happening has to do largely with the population density. In Wyoming, the houses are more spread out, so social distancing is kind of the norm, whereas in New York, everything is tight and congested, and it's really hard not to make contact with people. Also, employment. I think that a lot of people in the central or more rural parts of the United States, their employment isn't as much of a factor, given that many people work on their own land or have their own farms or businesses of such. Whereas in the New York, the poverty levels also change a lot. So a lot of people in New York have to still go to work. And they're traveling both inside and outside of the city. And then kind of piggybacking off of that, transportation, a lot of people are coming in and out of New York. So they're coming in from New Jersey, PA, Delaware, and then they're going back to those states and spreading it to them. And they're also coming in, and with everyone on the subway, relying heavily on public transportation and such, the rate of spread is much more drastic. And then noting onto why Germany had more cases than the UK but fewer deaths. So I took all of this from the New York Times, and there's studies going on as to Germany's practices and why this is happening. And they've noted that the average age of infected individuals is younger. So in Germany, people are getting infected, but they're also bouncing back afterwards because of their young age and immunity levels. Germany also developed a test back in mid-January before coronavirus was even a concern. So they had a test and posted a formula online that they could use by the time February came. Medics already had a stock of test kits, so they were really proactive in making decisions. They also are testing random samples as of April, late April. They're testing random samples of 100,000 people every week. So they want to see where the immunity is building up and where they need to put more focus and resources. And testing is free in Germany. Testing people is seen as proactive, so they're not waiting until symptoms are already there. If you want a test or if you think that you're about to show a symptom, um, it's very easy to access a free test. And they also have something that are called corona taxis. So it's something they've implemented of medics in fully protective gear driving around the cities and checking on patients at home. So this helps the spread decrease across healthcare workers and the overflux of resources needed. And then also, Germany has a big trust in their government. So when social distancing was put into place, it wasn't fought or like everyone was pretty much in agreement, and it didn't face any backlash. And then another result, as I just mentioned, was that the ratio given those Google charts, it lines up against other pandemics. So this could also be a factor of active unpreparedness. It really just took us all by shock, and there's a lot of uncertainty happening about how much we need to act, or there was procrastination that happened. So some states waited until the spread was already too late. Other states didn't jump on it or jumped on it, just in time. But there was also a difference between coronavirus and the other pandemics that happened, such as the Spanish flu in the healthcare system. So right now we're fortunate enough to have a lot of resources that may not have been available during those times. And it's hard to say if the spread would have happened so drastically in things like the Black Death or the Spanish flu if different resources were available. So those are just some factors that are interesting to analyze. And of course, like any research, there are some limitations. So the data that was used was extracted from April 24th and April 27th, and data is changing every single day. Some cases aren't reported, so it's hard to say how accurate the data is, because some people aren't going to healthcare facilities because they simply cannot afford it, or they simply cannot afford tests within the United States, so they're just leaving cases go unknown. And then some people are asymptomatic, and I wanted to include this quote here of a study that was done in New York that showed that 13.9% of those tested actually had antibodies in their system. And this means that there are actually about 2.7 million people that have been infected statewide within New York, as opposed to the 200,000 that are confirmed cases. And so, as you can see, data collection has its flaws. It's hard to say. It's hard to track things such as social distancing with privacy laws and things like that. And it's how much people are giving data to healthcare facilities and how much data healthcare facilities are giving to the public. But overall, to conclude, the ability to track viruses geographically is something that is groundbreaking and is super critical. It assists scientists in showing the rate and spread of diseases, so this helps showing the migration of where the disease is coming from versus where people are traveling out of, and just showing the overall path that it's taking. It also allows countries and states to prepare and seeing how quickly the disease is spreading, and it can also help show the cause of why this is happening, and the symptoms that people are experiencing. And most importantly, this helps put information into the hands of the general public. So humans are very visual creatures, and the act of seeing graphic representation of data, it leads to better comprehension, and it helps really encourage people to practice those social distancing laws. And it enables more local agencies to locate diseases within their areas and inform their general public and target services. So it allows us to project how many resources we would need, and laws that we should be taking and how much we should be preparing, and just showing the overall where areas are gaining immunity and the practices that they have in place. So these are all my references, but this was a super interesting study, and just keep washing your hands and stay safe out there, kids.